Upon completing this activity, you should be able to differentiate between thrombus and tumor using various ultrasound techniques and differentiating the characteristics between the two pathologies. So tumor invasion, again, any sort of echogenic material in the vein, we need to rule out if it's a tumor versus thrombus. What we're going to do, we're going to decrease our scale, increase our color, try to identify any sort of arterial blood flow without that vein or that echogenic material. Also going to check the IVC. Hepatocellular carcinoma, so HCC, you might hear this all the time, or patients might, for an indication, just be for an HCC check. Patients that have portal hypertension are at an increased risk for developing HCC or hepatocellular carcinoma. So if they have that, these patients will present and we'll be searching for that. And then patients who also have cirrhosis have a very high incidence of hepatocellular carcinoma at an estimated 3% per year at a risk for developing that. So these patients that have cirrhosis due to hepatitis B and C, they have the highest risk for developing HCC. Remember, we talked about renal cell carcinoma, the most common primary cancer in the kidneys. That can also propagate as well and cause tumor invasion. So in this image here, you see echogenic material partially obstructing in the IVC. We're not sure if it's tumor or clot, right? We have to throw color on that to differentiate the two, see if we can identify blood flow within that mass to come up with a better differential. But right now, if I saw this, I would think tumor versus thrombus. All right, so you can see in this image, we have an echogenic structure within this vein. And how do we know this is the IVC? It's labeled on here for inferior vena cava thrombus, but how would you know if just looking at this and it wasn't labeled? I hope that you identify and recognize this. Remember, nothing generally lives behind the IVC except for the right renal artery. So that's the right renal artery posterior to the IVC, and you can see this kind of echogenic structure within the vein there. So the sonographer put color on this. Remember, it's important to decrease the scale to look for any low flow within anything that could be a tumor versus thrombus. And in this situation, we put color on there, and you can see the color flow going around that, which it's tumor in this. So we want to turn the color gain up and the color scale down, and that's how we're going to help differentiate between the two. Remember, thrombus will have no flow within the mass, and the tumor, we will be able to identify flow.